I'm Glenn McGuinness, and this is Outburst. This week, are you getting the information you need about the safety of COVID-19 vaccines?
From what I'm reading, it seems pretty safe.
I mean, you're hearing different things from different sources.
Too much information. It worries you.
You know, I put my trust in them to inform me.
But first, it goes without saying that pretty much everywhere around the globe was not fully prepared for a pandemic of this size. There was a learning curve right from the beginning, which we still may be drawing some wisdom from to this day, as COVID-19 continues to have a profound effect on the lives of countless people here in Canada and around the world. As the vaccine rollout across the country is underway, we can only hope that it will help bring society back to a somewhat normal functioning capacity. But if it happens again in the future, what lessons can we take from this experience? Our question: how could Canada be better prepared for the next pandemic?
God, that's a good question. I would say look back at this one, see what we did right, see what we did wrong. I would say a faster vaccine rollout wouldn't hurt. And just, I mean, we did as good as we could do, I suppose, for what we were prepared for.
Certainly they should have their own production facility for vaccines. That's a major one. That's majorly why I think we're the vaccines are at such a slow rollout, because we have no production facilities.
Well, we could make vaccines. That would be huge. There's no vaccine manufacturing in Canada, so that's what I find one of the most irritating things about this pandemic.
Make good records of the research that has been done so far, and to keep in mind everything we've learned so far, I mean specifically about the virus and the vaccines.
Well, learn from what's gone wrong this time. I think they should have kind of a national plan so that everybody is on the same page in terms of protecting themselves, you know, and protecting other people. And also, I think that's it. I think the places that are having a hard time are people that have not had a clear message about, you know, hand washing, keeping distance, wearing masks, and people are kind of concerned more about their personal liberties instead of responsibilities. So I think that's basically it. I think in some cases the provinces have a bit too much control, and they're not, you know, firm enough.
I think information is the big thing, because there's a big disconnect between Ottawa and the provinces as to how to do this. So you get all these people that are believing that it's a pandemic and it's all fake. And so I think it's a big thing between the government and the public has to be more informed. Otherwise, you have a lot of people who don't want to wear masks, other people who don't want to get vaccinated.
I think fiscally, financially, having programs in place in the event of a pandemic to ensure people can survive this and keep their homes, and, you know, especially with local businesses and entrepreneurs, I think that's a big part of it as well. And what else? I think traveling, like, you know, across Canada and internationally, putting measures in place to ensure people are safely traveling, and, you know, maybe the quarantine and isolation rule needs to be continued for, you know, long after this.
Educating people that the science is not a fixed thing, and people change their, and as the things evolve, people will, the best advice changes, and they learn better, so there won't be all these problems with the changing message from the scientists and doctors, and make preparing our own capability to produce the essentials, PPE, vaccine, and anything else that might come in the future crisis.
In my own opinion, I think it will be better if you know, we have better rules in place, sensitization, which is very, very important, and you know, trying to you know, have a government that will be very responsive in tackling this pandemic even before it gets out of hand. I think these are ways that we can be ready before the next pandemic eats us.
Well, I think that possibly learning from this one, making sure that measures are in place prior to the pandemic actually occurring, and I think we did a pretty good job in terms of globally in the response to the pandemic, but I think getting the vaccines on the ground and making sure that science is funded and everything will definitely speed up the next one. And I think masks are here to stay. I don't really think that they're going anywhere, so that should probably help with the spread and everything.
I think just following the guidelines that we're doing right now, make sure. I think hygiene is probably something that we should probably continue, for sure. Washing your hands, staying 6 feet apart, maybe even wearing masks when it's flu season.
I just feel like people need to wash their hands and keep their masks on and just follow the rules. Because if they don't, it just makes it worse for everyone else.
I mean, I think that this has given us an opportunity to prepare better, just because we have the knowledge and resources now that I think, heaven forbid it should happen again. I think, with just basic experience and what to do and not to do, I think it will come a little bit more naturally, obviously, and we'll be more prepared with guidelines and work plans and such, that hopefully it will be administered, in a less chaotic way. There'll be fewer questions and gaps of knowledge. So that's what we're hopeful for, but we hope it never comes to that, obviously.
We should have been prepared by now. They're going to have to do something. They should never stop what they did. They stopped in the 1980s, and they must have known that the world's going to be coming sick again sometime. It happened 100 years ago and they didn't do much. Now it happened again and they're still caught with their pants down.
We are now more than 1 year into this pandemic, and restrictions continue across the country with the hopes of flattening the curve until everyone gets vaccinated. Being confined to your home or having limited activity can weigh heavily on a person, and some people are venting their frustrations by publicly protesting recent COVID-19 restrictions. While some will argue people have the right to protest if they feel their civil liberties are being violated, could this approach perhaps be counterproductive? Our question: what do you think about the protests over pandemic restrictions?
You can't protest. The pandemic is here. You can't protest the pandemic away. So it's kind of foolish in my mind.
I don't think they're very bright, to be honest. We had the restrictions for a reason, so that we can reduce spread. It's as simple as that. I don't think it has anything to do with personal freedom the way they would phrase it. I think a lot of those people would say that it's about personal freedom, something like that. Kind of like a libertarian mentality about it. But I don't think that's the issue at all. I just think it's about stopping the spread.
Some people have a point, I guess, but I'm pretty for all the restrictions that were put in place. I don't think we could be too careful. So I think the restrictions are very important.
I think people do got right to protest over the pandemic restriction. Like for example, the traveling people are coming back here. In my opinion, and in my own personal opinion, I think people should stop traveling. Because it's getting a lot worse here in St. John's. I can't speak for other people here in the city or across Canada, but I think people do got right to protest, to fight their rights and opinions and what should be done here in Canada. So that's something that I think they could do in case something happens down the road.
I really won't say what I really think because you wouldn't want to print it. I think it's crazy. I think people, if they don't jump on board and get this vaccine and get this world back on wheels, it's not much odds anyway. So people should join in and for the better of everybody and get their vaccine.
People speak out about everything, and that's crazy. Why don't they just live? And the government, we got rules. We got to follow rules, right? And you got to go by what our people in charge are saying. You got to do what they're saying, what our prime minister is saying, what our premier is saying. We need to do what they say. We just can't make up our own laws and speak out about everything. People are complaining about everything.
Complete foolishness, honestly. We are here in Newfoundland doing so well because we have followed restrictions. So that's, and it's worked. So those restrictions have worked. So there's no need to be protesting that anything that's actually working.
Foolishness. People have too much focus on their rights rather than their responsibilities and society in general. They're just more focused on their own inconvenience.
I don't think there's any place for that. I think it's very short-sighted, and people need to look at the bigger picture here with human lives and safety. So,
I think they're idiotic. I think again, I mentioned responsibility. If even if people are trying to stay well, people who are protesting and who are refusing to comply are making other people sick and filling up the ICUs, so that if they themselves get anything wrong with them, they're going to find they may not be the help they need, because the hospitals are all full of trying to treat COVID patients, which could have been prevented by certain measures. Easy measures.
It's one of those things where, I understand, but I understand why they're protesting, but at the same time, the government's just looking out for their best interests.
I think they're foolish. People get the right to protest. Supposed to be a free country. Take away our freedom, then we're a dictatorship.
I don't know if I really understand, why people are so resistant to, this, global effort to stop this deadly virus. I put myself and my family's safety first, and if I'm being told that this deadly disease requires me to wash my hands more and sanitize and wear a mask, then I'm absolutely going to do it, no question. So I just don't understand that point of view.
It's just going to be from my own point of view, right? So I think those that are protesting, they have the right to protest. However, the appeal or my own opinion is going to be, let us look at their reasons for protest and see if there are valid reasons behind those reasons. If there are valid reasons, of course, we could listen and together we could all come out together and educate each other on why the restrictions are put in place, as against trying to enforce the restrictions on people without really knowing the reason why the restrictions are put in place. But I think all in all, they have a reason to protest.
I don't understand, because like I said earlier, the country's doing everything it possibly can do. So, and these restrictions are necessary to prevent COVID from spreading. So I don't agree with the anti-protest at all.
The longest federal election in modern Canadian history took place in what year? 1958, 1993, or 2015? The answer, 2015. The 2015 federal election campaign was the longest in modern Canadian history. The election began on August 4th of that year, and voting day was on October 19th, a total of 11 weeks or 78 days. The 1872 campaign lasted 89 days, but did not practice one-day votes, as we do today. According to Elections Canada, a minimum campaign must be 36 days, but there was no maximum length for a federal election campaign at the time. But since 2015, the maximum number of days was changed to 50 days, up to Election Day. Following a long stretch of cross-country campaigning for most of the federal leaders, and while Prime Minister Stephen Harper was looking for his fourth consecutive mandate, Justin Trudeau's Liberals became the first federal party in Canadian history to win a majority without being the governing party or official opposition leading up to an election. While vaccines are being administered across the nation, not everyone will be getting the same kind. Of course, there are different brands, with some being linked to rare blood clots. While federal and provincial medical authorities continue to tell us that the benefits outweigh the risks and that every Canadian should get the first shot offered to them, there are those who will hold out until they know more about what they're getting. So we took to the streets to ask Canadians if they're informed enough before they get their shots. Our question:
are you getting the information you need about the safety of COVID-19 vaccines?
You know, I've been very informed, and I've been safe through this whole thing because of our healthcare professionals. And I think being in New Brunswick, we have the right team in place, and we're certainly excelling more than other provinces. And I thank Jennifer Russell and Public Health Safety for their information.
I'm hearing a lot of bad stuff, so I'm not too big of a fan on it. I'm hearing a lot of bad stuff about it, bad side effects. So I'm not a big promoter of vaccines, I guess. Yeah, I'm hearing a lot of bad stuff about it. Perfect. So I'm probably not going to do it myself.
Yes, I think the government is really doing good in trying to educate the people on, the safety and the importance of the vaccine. I think they are really doing good, but there's still room for improvement, in the sense that I would expect to hear more jingles. I would expect to hear more engagement from authorities, from people in health sector, and even not just the government alone, from the private sector. People could engage the public, the members of the public, to do more. So yes, I think we could still do more.
The information is out there. I mean, unless somebody's lying under a rock or something, then, but yeah.
I think the source of information is important. I think we need to really tune in to our public health officials for that official information. We can make judgments on things we hear through the media and otherwise, and I think it's just important that we follow our public health advisors and let them, they're the professionals, and they have first-hand knowledge, and I put my trust in them to inform me of what I need to do, what precautions I need to take, and whether certain vaccines are safe or not. We've never experienced this before, so it just evolves daily, and I do feel a comfort knowing that at least in New Brunswick, I think Dr. Russell has done a tremendous job in keeping everyone well informed. She's a trustworthy source, and I would go to the source, the Government of New Brunswick website, if I really wanted to know what the actual facts are.
To what's being put out there from we got our media and what I can find on the internet that's coming straight from the manufacturer. Yeah, I'd say that, yeah, I'm pretty well informed as to what's going on. Maybe not with each individual vaccine from each individual different companies, but yeah, I'd say for the most part, that I feel informed.
That's a hard one. I'm not sure, to be honest. I mean, you're hearing different things from different sources, so from what I've heard, I'm a bit wary on some, but we'll see what the next few months have to bring.
Sure I am. I'm not really concerned about it. They got lots of problems with the different types of, the people got blood clots and all that stuff, and this, it's just normal stuff. I got it and I don't have a problem with it. And I got to get another one in July, so I don't have a problem with that. But there are people that got lots of problems, and everybody, no matter what you do, they got complaints and problems.
From what I'm reading, it seems pretty safe, or at least some of them do.
Yes, I think so. I think we're getting as much information as we can get. It's an incomplete picture so far, as there's just discovering it. But we're getting everything that nobody's hiding anything from us.
Well, I find all the fuss about the AstraZeneca blood clots really annoying, because take the women's birth control pill, for example. blood clots have always been a much greater risk for the women's birth control pill than they have been for the AstraZeneca. So far, I think we have 3 possible blood clots in Canada, all of which are being treated, versus how many people in Canada have died of COVID? 24,000, is it? The number keeps changing, I'm not sure. And so every time there's a new blood clot announced, it's like news, and they're just, like, it's not balanced against the number of deaths and the number of illnesses caused by COVID.
Yes, I am. Yeah, I'm vaccinated. I was vaccinated Monday because I fall in between 55 and 64 the AstraZeneca. So I had my vaccine this past Monday.
And you're satisfied with the information?
100% satisfied.
No, I don't think so. I think I'm getting little tidbits, but I'd like to be more informed of the vaccines, how they were produced, and I'm by no means an anti-vaxxer, but I think I would like to know more about it.
I would say it's available. I would say, yeah. I would say there's plenty of information which suggests that the vaccines are safe. Obviously, there's some, things to be concerned about, but I think by and large it's more than safe, and I think a lot of what some people are saying about it is just hysteria and wackiness in terms of it not being safe.
Yeah, I think I've had availability of sufficient research, and there's been quite a few different channels for information from the scientists. So, yeah.
I believe we are, yeah. There's always news. There's always available news on good sources, reliable sources. Yeah, I think the vaccines are much less dangerous than the disease, so I think I'd rather take a chance. I've already had a vaccination. Yay!
As mentioned earlier, restrictions have been in place for quite some time now. And what those restrictions are, or how stringent they may be, may depend on which province you live in. We've seen lockdowns, Atlantic bubbles open, then close again, curfews in Quebec, and of course, a stay-at-home order here in Ontario. And experts tell us these measures help to contain the spread of the virus. In some provinces, when the numbers went down, restrictions were eased, but then in many places, the numbers went back up again. Each province works from its own playbook, but are they doing enough to keep things under control? Our question.
Do COVID-19 restrictions in your province go far enough?
I think the Premier could do a lot more in what he's doing. I think he's too much time at his table and not out there among the people finding what's really going on. He seems to favor one area over another all the time, and the people in New Brunswick are all one big group, but he keeps isolating everybody. And that's not right. We're supposed to be one country, one people.
I mean, I think that, during certain phases, particularly when this municipality went back into a restrictive orange phase, and we still had some, employers suggesting that, we can continue to work and be in larger environments that are open to the public. That didn't sit well with me. I think that there should be sort of a provincial mandate that requires us, as large employers or municipalities or what have you, to be as safe as possible. And if that means, working from home again, as many employers continue to do with their employees, let's avoid that risk, and do that, because we've proven we have before. So, let's take public health, make that our first priority over productivity.
Like when the lockdown was, it was really stressful because everyone was, stressed out. But I think now it's a lot more flexible, and people are still coming together and stuff. And yeah, I think we've got some flexible rules, and it's not as bad as other places. I believe so. Maybe they could have gone a little further with it, hypothetically speaking, but I think they went far enough with it. I mean, I'm pleased with it. I don't have COVID, and once again, we're in a bubble here, it seems. So St. John, New Brunswick is doing quite well. As far as the rest of the country goes, I'm not really too certain.
I think yes, because in this part of Canada, I think we've been lucky to to keep it under check, and all thanks to the restriction that that was put in place earlier before the proportion before it got blown, in other provinces. But I think the restriction here has really helped us to manage it, and keep it under check, which I think, in my opinion, is, it's very good.
Yeah, I think they did. I think they're doing a great job, honestly. I feel like I'm very informed, and I feel like, especially here in New Brunswick, if there is a serious outbreak, I'm going to be taken care of. So yeah, I feel like it's been good.
Oh, I think Newfoundland's doing fine. I think Newfoundland's been, on the whole, doing very well. I think I had great admiration for the way it's being handled here and for the people of Newfoundland who seem to have a kind of social responsibility.
I think for Newfoundland it does. For this province where we are right now, yes. If we were having the cases like Calgary and Ottawa and those places, definitely not, but I think they're proportionate to what we're dealing with.
I think so. It seems to be working. Well, most of the time our cases are only travelers coming in, and it doesn't spread far from them. And in the one case one of the few cases when it did, we cracked down quickly and got it under control within a few days. So I think we're doing okay with our restrictions here. And people are following them.
I would say we're doing a great job here. I mean, the numbers show, and so far so good.
All except with the airlines. I think that Newfoundland should have no flights in, no flights out, unless it's food and whatever else that we need here. But I think that's about the only thing that we should, right from the get-go, should have stopped that, and maybe we wouldn't have had the variants here.
I feel good here. I feel like we're getting good advice and we're following the advice.
Yes, I think Newfoundland got a good grasp on it, and they're doing a great job. And I think the government and our Department of Health is doing a fantastic job.
So far, things have worked, and reactions to outbreaks have been immediate and very clear. So it's working. So yes.
I say we're doing really good in Newfoundland. We're doing good. Once the only problem is now they start opening the borders, we're in trouble. Because the people are traveling all over the world, and they got to do that. They got to travel. They got to work, right? So, it's. I think we're doing great in Newfoundland. I think we got a good government in now, a good leader. So I think he got everything under control.
Thanks for watching this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. It's your turn to speak up, and we're listening.